known as moon face. It's a term that paints a picture of a face round and swollen, much like the full moon. But it's more than just an intriguing description. This condition is characterized by facial swelling, a result of fluid buildup. It might be easy to pass it off as a result of weight gain or chubby cheeks, but it goes beyond that. Moon face can be brought on by a myriad of factors, painting a complex picture of our body's intricate workings. It could be a reaction to medication or surgery, allergies, infections, certain underlying health conditions, or even changes in weight. But, as we will see, identifying the cause is crucial. It's not about vanity or aesthetics, but about understanding our bodies better and ensuring our health is not at stake. So let's delve deeper to understand what really causes moon face. One might think that a round face is simply due to weight gain, but it's not always the case. Indeed, a myriad of factors can contribute to the distinctive puffiness known as moon face. Let's delve deeper into the common causes, starting with Cushing's syndrome. This condition is characterized by the body's overproduction of cortisol, a hormone that regulates a variety of processes throughout the body. This overproduction can lead to a host of symptoms, one of which is facial swelling or moon face. Then there are corticosteroids, medications often used to reduce inflammation in the body. Prednisone, for instance, is a corticosteroid that can cause moon face when taken in excess or for an extended period. It's important to remember that while these medications can be incredibly beneficial, they should always be used under the guidance of a healthcare provider to avoid potential side effects. But the causes of moon face aren't limited to hormonal imbalances or medication use. Reactions to certain medical procedures or surgeries can also lead to this condition. For example, after a surgical procedure, the body may retain fluid as part of the healing process, which can result in facial swelling. Similarly, allergies and infections can cause moon face. Both conditions trigger the body's immune response, which can lead to inflammation and fluid retention. The face, being a sensitive area, can easily become swollen during these immune responses. Weight changes too can contribute to moon face. Both malnutrition and obesity can lead to facial swelling. In the case of malnutrition, the body may retain water as a survival mechanism, leading to puffiness. On the other hand, obesity can cause moon face due to the accumulation of fat cells in the facial area. Finally, certain medications and medical treatments can also cause moon face. These can range from drugs used to treat conditions such as epilepsy or bipolar disorder, to treatments like chemotherapy, which can cause fluid retention as a side effect. As you can see, moon face isn't just about gaining weight, it's a complex issue that involves various factors. Now you might be wondering, what does cortisol and corticosteroids have to do with moon face? Well, allow me to enlighten you. You see, cortisol is a hormone that our bodies naturally produce. It's often referred to as the stress hormone because its production increases when we're under physical or emotional stress. But cortisol is much more than just a stress response trigger. It plays a vital role in a host of bodily functions, including the regulation of blood sugar levels, metabolism, and inflammation reduction. However, as with many things in life, too much of a good thing can be bad. Excessive cortisol production can lead to a condition known as Cushing's syndrome. This condition is characterized by weight gain, a hump between the shoulders, and yes, you guessed it, moon face. Now let's talk about corticosteroids. These are a type of medication that mimic the effects of cortisol. They are often prescribed to reduce inflammation and suppress the immune system in conditions such as asthma, lupus, and rheumatoid arthritis. But similar to natural cortisol, when corticosteroids are taken in excess or for prolonged periods, they can cause side effects. And one of those side effects is indeed moon face. So you see, both cortisol and corticosteroids play a significant role in the development of moon face. It's not simply a matter of the quantity of these substances in your body. The duration of exposure also plays a crucial role. The longer your body is exposed to high levels of cortisol or corticosteroids, the higher the risk of developing moon face. So it's not just about the quantity, but also the duration of exposure to these substances that can cause moon face. Apart from the body's hormonal balance, other factors can also cause moon face. Let's delve deeper into some of these causes. Starting off with malnutrition, it may seem a tad contradictory, but yes, even malnutrition can lead to moon face. This is because when the body is not receiving adequate nutrients, it can respond by retaining water, leading to swelling. This fluid retention can be particularly noticeable in the face, hence causing a moon-like appearance. Moving on to obesity. This is a condition characterized by excessive body fat. When a person is obese, fat deposits can accumulate in different parts of the body, including the face. This buildup of fat can give the face a round, full appearance, which is often associated with moon face. Now let's talk about certain medications and medical treatments. Some drugs, particularly those that affect the body's water and salt balance, can cause fluid retention. This includes certain types of blood pressure medications, anti-inflammatory drugs, and even some psychiatric medications. Similarly, medical treatments that cause hormonal imbalances or inflammation can also trigger moon face. It's important to note that these are not the only causes. Other factors such as allergies, infections, and certain underlying health conditions can also contribute to the development of moon face. Understanding these causes is crucial, as it helps us realize that moon face is more than just a superficial concern. It's a potential sign of underlying health issues and should not be taken lightly. So moon face is not just a cosmetic issue, it's a health concern that needs attention. If moon face is a health concern, how do we identify and treat it? An excellent question indeed, and one that we'll dive into now. One of the most important aspects of addressing moon face, as with many health issues, is early detection. This involves being attentive to changes in your facial appearance, particularly an increase in roundness or puffiness, and not hesitating to seek medical attention if you notice such signs. Now, the identification process for moon face typically involves a comprehensive review of your medical history. This is crucial as it gives your healthcare provider a chance to identify any underlying health conditions or medication use that may be contributing to the moon face. It's important to be open and honest during this process, as every bit of information can help in pinpointing the cause. In addition to your medical history, a physical examination is often conducted. This involves your healthcare provider thoroughly examining your face for signs of swelling or fluid buildup. They may also check other areas of the body, as moon face can sometimes be accompanied by weight gain or swelling in other areas. Diagnostic tests may also be used to help identify the cause of moon face. These can include blood tests to check for high levels of cortisol, a hormone often linked with moon face, or imaging tests such as CT scans to look for other potential causes like tumors. Once the cause of moon face has been identified, treatment can begin. It's important to note that treatment for moon face is typically aimed at addressing the underlying cause. For instance, if the moon face is a result of excessive cortisol production, as seen in Cushing's syndrome, treatment may involve medications to lower cortisol levels. If the moon face is a side effect of corticosteroid use, your healthcare provider may suggest adjusting the dosage or switching to a different medication. But remember, never alter your medication regimen without first consulting your healthcare provider. For cases where moon face is related to weight changes or obesity, a healthy diet and regular exercise can often help reduce the facial puffiness. Nutritional counseling or a referral to a dietitian may be beneficial in such cases. In some instances, moon face may be a symptom of an allergy or infection. In these cases, treating the underlying condition often resolves the moon face. This could involve antibiotics for an infection or antihistamines and avoidance strategies for allergies. Remember, early detection is key in handling moon face, and the treatment depends on the underlying cause. So if you notice any changes, don't hesitate to seek medical advice. Your health is your wealth after all. Now let's address some common questions people often have about moon face. First up, is moon face permanent? The answer is not necessarily. Moon face in most cases is a symptom of an underlying condition or a side effect of certain medications. Once the root cause is addressed, the facial swelling typically subsides. However, it's important to note that the timing can vary greatly depending on the specific circumstances. Moving on, many of you have asked, can diet and exercise help reduce moon face? The answer is yes, but with a caveat. While a healthy lifestyle can certainly help manage weight and fluid retention, it may not directly resolve moon face if the cause is related to hormonal imbalance or medication. Nevertheless, maintaining a balanced diet and regular exercise regimen contributes to overall health and can certainly aid in recovery. The next question we often hear is, are there any home remedies for moon face? While there are no specific home remedies for moon face, certain lifestyle changes can help manage the symptom. Drinking plenty of water, reducing salt intake, and getting enough sleep can all help your body better regulate fluid levels. However, it's crucial to remember that these measures are supportive, not curative. If you're experiencing moon face, it's essential to seek medical advice to identify and treat the underlying cause. So, can moon face be prevented? The prevention of moon face largely depends on its cause. If it's a side effect of medication, working closely with your healthcare provider to manage your prescription can help. If it's due to a health condition, treating or managing that condition is key. In cases where moon face is due to lifestyle factors, making healthier choices can certainly aid prevention. But remember, prevention is not always possible, especially when moon face is a symptom of unavoidable medical treatments or conditions. Lastly, what is the treatment for moon face? Treatment focuses on addressing the root cause. This could mean adjusting medication, treating the underlying health condition, or making lifestyle changes. In some cases, a healthcare provider may recommend specific treatments to manage fluid retention. Every situation is unique, so it's vital to discuss your symptoms and options with a healthcare provider. With the right knowledge and awareness, we can better understand and manage conditions like moon face.